So, welcome everybody. Today, we're going to talk about patient and caregiver supportive needs in advanced cancer and really essentially what you need to know. So, we're going to talk about clarifying terminology around advanced cancer, goals of care conversations, and patient and caregiver supports. So, one of the important things about these types of conversations is we really do have a very clear structure that we can go through. So, understanding of the diagnosis and prognosis, as well as symptom management, and talking about medication management, as well as complementary therapies. We'll talk about coping supports, advanced care planning, as well as goals of care conversations. So, in understanding diagnosis and prognosis, we've found that sometimes patients and families don't have a very good understanding of what their actual diagnosis and prognosis is. And that is often, slide will not advance, sorry. There we go. Thank you so much. So with the diagnosis and prognosis, often I've found that it's not very clearly articulated or explained. A lot of healthcare providers seem to have, some discomfort in having those types of conversations. Yet at the same time, that information is absolutely essential for patients and caregivers to make informed decisions, to know what's going on. And the more that healthcare providers tend to shy away from those conversations, the more distress it ends up creating among patients and families, as well as for other members of the team. So it's really important that we do go over understanding of diagnosis and prognosis. So in recurrent cancer, I'll back up. The advanced cancer is really a general term describing later stages of cancer. And this can be used differently in different kinds of cancer. There's really no one size fits all definition. And while many of the terms overlap with each other when we talk about advanced cancers, they don't always mean the same thing. So, while for most this may mean focusing on staying as healthy and feeling as well as possible for as long as we can, and for others, this may mean that the cancer will be managed as a chronic illness. So, when you need information specific to your cancer, it really is always best to speak with your oncologist. Other terms frequently used for advanced cancer might be metastatic cancer. So that means that the cancer has spread to more distant parts of the body. And we also sometimes call this a stage 4 cancer or terminal cancer, as stage 4 is the highest possible stage. While it may most frequently be the case that a metastatic cancer cannot be cured, it's not always the case for all metastatic cancers. And again, when you need information specific to you, you should be discussing that with your oncologist. Sometimes we use the term locally advanced cancer, which usually means that the cancer is only involved in nearby areas from where it started. And this is very cancer site specific on how it can be treated. So when we're talking about, sorry, my slide will not advance. Next slide, please. Thank you. When cancer returns or recurrent cancer, it can come back in the same spot or even a different part of the body as the original cancer. Often, when it comes back, it's harder to treat as it may have become more resistant to the therapies that we're using to treat it earlier. And recurrent cancer is not always incurable. That's really going to depend on what kind of cancer it is and whether it's close to the original site or if it's further away. So, when we don't have treatments to cure the cancer, we can sometimes use treatments to help shrink the tumor or slow the tumor growth, or even to relieve symptoms that are caused by the tumor. And when a treatment is intended to cure the cancer, we call it a curative intent treatment, because that's the intent that we're going for. When it's intended to just shrink the tumor or slow its growth or manage the symptoms, we call it a palliative intent treatment. And I know that, whenever people hear the word palliative, culturally, we have thought of that previously as meaning end of life, but that's really not what we're meaning in this scenario. And I think that's really important for us as healthcare providers to really clarify for patients, because otherwise that can be a very scary term. Perfect. And so here's a little chart on palliative care, and I hope that it really clarifies some of some of the meaning around that. As you can see, really it ranges all the way from disease management and up to actual end of life palliative care. And because that focus has been more so on the later stages there, that's why we get this idea that palliative means end of life, but actually it does mean best quality of life. And that's what we're going for as far as treating symptoms and helping somebody to really live well, the best that they can. And this type of care should really start all the way at the beginning of a diagnosis of a cancer that we know we can't cure. It doesn't mean that we're, waiting until after treatments have been completed or after there's no longer anything to offer. This is the type of treatment that should really go alongside with any type of other cancer-directed treatments, and for multiple reasons, which actually will move on. So, symptom management, as we were talking about, is really central to the care of people living with advanced cancer because it directly affects quality of life. It affects functional ability, even treatment tolerance, because if we're able to better manage symptoms related or side effects related to the treatment, then people can better tolerate the treatment. It also impacts emotional well being. So, in advanced disease, symptoms are often multiple, they can be severe, and they're interrelated. So, one impacts the other, making this type of proactive expert management, this palliative management, really essential. Some of the key reasons that this symptom management is so important is, like I said, the symptom burden can be very high and often progressive. So, advanced cancers can commonly include symptoms like pain or shortness of breath or fatigue, nausea, the inability to eat very well, the inability to sleep well, depression, anxiety, and even cognitive changes. So, changes in your mental ability. These symptoms often intensify as disease progresses, and unrelated symptoms can compound one another. For example, if someone's having pain, maybe they're not sleeping very well then because pain is keeping them awake, which then impacts their ability to function during the day. They're much more fatigued. And when they're unable to do the things that they want to be doing during the day, and are just spending their time so tired and fatigued, this can create emotional distress. So you can see how all of these things sort of impact one another and can add up. So, symptoms also, of course, directly affect quality of life, especially uncontrolled symptoms. They can reduce independence, your ability to move around well, your appetite, your sleep, and of course, our social engagement. When we're not feeling well, it's hard to have, these conversations or going out for dinner with friends, things like that. And this loss of function can feel as distressing as the cancer itself. This high symptom burden really correlates with a lower quality of life, increased psychological or mental and emotional distress, and even poor caregiver outcomes, because it is also very challenging to be the caregiver and not be able to fix these things for somebody that you love. Effective symptom management, which is, again, pulling in the word palliative care to mean this expert symptom management for the best possible quality of life. It really enables patients to pursue meaningful goals. So when symptoms are controlled, patients are more likely to be able to attend appointments or really engage with their loved ones, participate in all kinds of important conversations that really need to be had around this time to maintain their own routines and a sense of normalcy and autonomy or self-direction in their life. And then, of course, to achieve some personal goals, like maybe there's an upcoming wedding that's really important in the family, or being able to stay up long enough and feel well enough to visit with family that's come to see them. Symptom management also can improve your tolerance or your ability to handle your cancer treatments. So, symptom distress is one of the most common reasons patients will stop their chemotherapy or even decline any further therapies. So, managing these symptoms well right from the start can improve your ability to receive your cancer treatments, your ability to complete any of these planned treatments, and resilience for those side effects. And even when treatment is no longer possible, managing the symptoms that actually come from tumor burden would also prevent, a lot of unnecessary suffering. It can also reduce emergency room visits and hospitalizations. I mean, we all know nobody wants to go to the emergency room and wait for hours and hours and hours when they're feeling unwell. We know that these poorly controlled symptoms do frequently lead to emergency department visits or even an unplanned hospital admission, and using a lot more healthcare services that maybe wouldn't have been necessary if symptoms were managed properly up front. So, an early and integrated symptom management can absolutely reduce these crises and support care that is preferred in your preferred settings, like being able to stay at home as opposed to a hospital admission. Better symptom management, as we said, supports emotional and existential well being. So, symptoms like pain and that breathlessness, fatigue, can often trigger other emotions like fear or hopelessness and anxiety, especially in the setting of advanced cancer. So, responsive symptom control can really help patients and their caregivers feel safer in their environment at home, feel more in control, and feel less overwhelmed by their illness. This is really central, like I mentioned, to palliative care's holistic approach, or patient-centered approach, looking at all of these different aspects, not just the treatment, not just symptoms, not just what the patient wants, but all of these things together. And it embodies those core goals of what we would say is palliative care: to relieve any suffering, to improve your physical functioning, to support your quality of life, and address those physical, psychological, social, and spiritual needs. And, from my perspective, I would also say that this is ethically essential. I think that us as clinicians, we have a duty to prevent and to relieve any type of suffering, whether it's related to the cancer or related to the treatments that we're offering. And failing to treat those symptoms could constitute an avoidable harm. So it's really important, I would say, to identify primary palliative care role. So meaning, your medical oncologist or your family doctor who could do some of these less complex pieces of symptom management. And knowing when then it's become more complex and we really need to involve a specialist who specializes in palliative care and symptom management. The importance of excuse me, proper medication management and complementary therapies. The importance comes from how they directly affect that symptom control and safety and quality of life and patient and family or caregiver autonomy. In this medication management, obviously, we want effective symptom control, um, and we want to prevent both under treatment, but we also want to prevent toxicity or over treatment. It's also important for us to look at that medication management to reduce polypharmacy and adverse effects. So, making sure that we're going over what medications you're using can help to avoid drug interactions or risks for other complications of too many medications, like a risk for delirium or dosing errors, especially if there's a lot of medications on board, which there can be. We also want to make sure that we're aligning those medications with the goals of someone's care. So sometimes that looks like de-prescribing or stopping to take some medications that are no longer beneficial in this specific setting. So, for instance, sometimes people are on a longer acting medication that's meant to really take effect or reduce the impact of an illness over years, like a cholesterol medication, for example. It takes years for that cholesterol to build up, and that's something that may not be necessary, or they may not be able to experience the benefits of that medication long term. So then we really don't need to necessarily be taking that medication, and it's one less in the whole plethora of medications that sometimes people are on. Um, Enhancing safety is also another part of this. We don't want to duplicate our medications. We don't want to cause confusion with too many medications. And again, related to the safety of the medications, we want to avoid any emergency department visits. When you have less medications that you have to keep track of and do the timing, of course, then we know that people can feel more confident and less confused, and also take what they need to take. I can't tell you how many times I've heard somebody say, well, I took all of my morning pills and now I feel like that was my breakfast. I'm not hungry anymore. I took so many pills. Now, when we're looking at complementary therapies, I should say, is really things that are added on that are not necessarily a specifically prescribed medication, but other ways that we can reduce symptoms. So sometimes people will even add on like a heating pad. We would call that a complementary therapy. Sometimes people will have, acupuncture or massage or different types of therapies like mindfulness and music therapy. And those are important components of the overall plan of care as well. That really improves quality of life. It improves that relaxation, the emotional support, and a sense of control. Then I would say with complementary therapies, it's really important to make sure that for us that we're providing culturally safe care. Sometimes it's within specific cultures that there are additional therapies that are not necessarily recognized by the medical profession as a medical related therapy. But culturally, it's really important for people to have that. And so for us to incorporate that in our person-centered care should, encourage an open dialogue about traditional or cultural practices, which, strengthen the trust and between patient and care provider. Now, it's also important for us to not overlook complementary therapies like addressing spiritual and emotional needs. Because when somebody has a cancer diagnosis, of course, they're not just a cancer diagnosis, they're a whole person with those very important needs. And for us to be able to support coping and meaning making, as well as psychological and spiritual well being in that, is an important factor. So, when we're looking at what types of supports are available, I just want to mention that Cancer Care offers many embedded services for advanced cancer throughout clinics, such as advanced cancer booklets that can be taken home for written information for people to go through as they're able. We have a few booklets they're a little bit maybe intimidating when you look at it. They're kind of thick. They have a lot of different sections to them, but they're really meant for you to take home and to be able to digest the information as it suits you, right? So going through those booklets would be very helpful for a lot of people, and being able to do that at your own pace, at your own time. Now, conversations about your goals of care and advanced care planning preferences can all be done within oncology visits. And additionally, we offer psychosocial oncology referrals to social workers, counselors for additional support in managing mental, emotional, practical, and financial needs. And at this time, we also offer an early palliative care program that's available at the moment to actually only advanced pancreatic cancer patients, but we really hope to be able to offer that to other advanced cancers in the future, because it really does address all of these things right from the time of diagnosis. So when we talk about advanced care planning, what do I mean? People don't always understand, and it actually is just what it sounds like: planning for your care in advance. So it's not some big scary thing, but it really helps you to think about what matters most to you and to make sure that your voice guides your care, both now and in the future. So we know that cancer and its treatments can bring unexpected changes, and advanced care planning helps to ensure that your care stays aligned with what you consider a good quality of life. It can really reduce stress for your loved ones, because when we've had those conversations up front and ahead of time, they don't have to guess what you would want for yourself. And essentially, the planning for your care in advance, or advanced care planning, really allows us as the healthcare team, but also your family and friends and those around you, to know what you would want if you weren't able to speak for yourself for whatever reason. And it helps us to be able to act with clarity and with confidence. And really, advanced care planning is something that we should all be doing. It's actually not just for cancer patients or even advanced cancer patients, but anytime there is, maybe a shift in your medical condition, it's a really good thing to review. It's a way to share your values, your worries, your hopes, and to decide what types of medical care you would or would not want. It's also helpful when you can choose a person, we would also call that a substitute decision maker, who could speak for you if you were too sick or too ill to speak for yourself. And again, make sure that us as your healthcare team isn't doing anything that you wouldn't want, and also isn't doing anything that you would want. And that your family can also be very clear on that and understand your wishes. So how do we do this? What can you do? There's a little QR code there that you can actually scan, which takes you to, let me back up a slide, sorry. Thank you. So we have a little QR code there that shows what you can actually connect through. There's a whole booklet on there that talks about what makes life meaningful, what worries you, what comforts you. It's important that you're able to talk to someone that you trust, and choose a substitute decision maker, or sometimes we call that a healthcare proxy, to tell them your wishes. You can discuss your goals with your care team and ask questions about treatment options, symptoms, and what to expect. And then another important aspect about that is to write it down. So completing an advanced care plan or an advanced directive, you can update that at any time. We would expect that to change over time. Maybe at the beginning of an illness, you would want more interventions, but as disease progresses, you might actually find that isn't what suits you anymore, and you would want less, or sometimes that can change and you actually would want more. So it's really an individual and personal preference, but it's important to revisit those things as we go. So advanced care planning is really about being in control, about making informed choices and ensuring that the care that you're receiving really reflects your goals and your values and your definition of quality of life. So, talking about goals of care, which I've mentioned a few times, it overlaps a little bit and is related to advanced care planning, but it's not the same. So, advanced care planning is what you would want in general for your medical care. And the goals of care is more about who you are and how your healthcare team uses that information to guide your care right now. So the goals of care is the overall direction for your treatment. And these goals of care conversations can help you and your healthcare team to make those medical decisions that matches what matters most to you. We're all different. We all have different things that are important to us in life. And when we can actually take the time to discuss that, between a provider and a patient, it allows us, of course, as healthcare providers, to really direct those treatments and those options and that support to what matters most to you. And advanced cancer does change over time, and your goals might change too. So having those clear goals and a repeated discussion, it doesn't have to come up every time, right? But if there's something that's changed in your life, then sometimes we would also change the recommended treatments that support that quality of life. For example, if there was some upcoming major family event that was, let's say, in another province, something like that. If we don't know about that, it's really hard for us to help direct your treatment. But if we do know about things like that that are important to you, or maybe grandkids are coming in to visit from somewhere else, and you want to feel really good for that visit, you want to have the energy to do that, we can redirect treatment to say maybe take a little bit of a break from your chemotherapy just before that to help you feel a bit better. Or sometimes we actually have some medication that can help increase your energy and your ability to visit well with family, or have the stamina to attend that event, or even make other suggestions about how you can best be present in that event, whether that means maybe recommending things that you wouldn't have necessarily thought of, like making sure that you have a quiet place to rest so that you can go and do that in between. It also really does help to reduce that uncertainty for you and your family in these conversations, and of course can help guide decisions during serious illness or even emergency. So these goals of care conversations really reflect what you value in your life and your health, the things that you hope for, even the kinds of things that you want to avoid, so that that medical care that you're receiving is right for you in that moment. Some common types of goals that we have, or that anybody might have, it could be just one thing to focus on. It could be a mix of different things. So somebody might want life prolonging treatments, right? That might be the focus. It's important for me to be here for as long as possible. And we can accomplish some of those things with chemotherapy or radiation or other procedures. Others might want to focus strictly on symptom control and comfort. That's what matters most to them. I just want to feel as symptom free and comfortable as possible. Other people might have a goal of maintaining independence and their daily activities, and being able to function in the most normal way is what's most important to them. For others, it might mean spending meaningful time with loved ones, and that's what's most important to them. And then for others, they might have a more comfort-focused care towards the end of life. And there is no really right or wrong in any of these goals. It's just what's right for you. And that's what makes these conversations so important, is for us to be able to understand what's right for you. So, how can we actually talk about these goals of care, right? That can be not an easy conversation necessarily to bring up. Sometimes people want to focus, only on positive things, or focus only on treatments. So sometimes these conversations can be difficult for patients to bring up, for families to bring up. It can even be hard for providers to bring up. But starting the conversation with just talking about your values, your routines, the relationships, the important relationships that you have in your life, and what makes life meaningful for you. We can talk about, sharing your biggest hopes. I hope to be able to feel really well at a Christmas gathering. I really want to be able to stay engaged in those conversations and not have to feel like I'm in pain and it's making me feel more irritable, right? We can talk about what you hope to do. So hope to stay comfortable or hope to spend more time at home. You could hope to continue treatment. You could hope to maintain your independence. That's one way to look at it. Another way is sharing your worries or fears. And this helps, us as your healthcare team to understand what you would want to avoid. So sometimes that's avoiding suffering or avoiding treatment, avoiding ending treatment early. It could be avoiding just thinking, about future things like, oh, I'm so worried that I'm going to suffer because I had a negative experience with something else. And so to talk these things out is often very helpful because we often have information that would allay a lot of those worries and fears if we can bring the conversation up. Talking about, your quality of life, describing what a good quality of life looks like for you, what's acceptable, what's not acceptable. And again, that's so different for everybody. Can we go back a slide? Sorry. Thank you. Talking about what a good quality of life is for some people might be different for other people. Some people might say that, they would want to be able to spend time in the garden. That might be more important to them. For others, it might be just being able to stay up, to watch your favorite show or the Jets game, whatever that is. We also, you could ask questions. I think it's really important actually that patients and families feel comfortable to ask questions about their illness and about treatments so that they know what to expect, how disease progresses or how treatments are going to impact them. And then, talking about what gives you comfort or what gives you strength. Those are also important things for us to incorporate so that we are putting that at the front of how we're making decisions as far as treatment goes. And then, of course, telling your team what you would prefer for decision making. So some families really prefer to have one point person who does the decision making. Some people like to do it as a collaborative altogether. And other people really look to their healthcare provider to make recommendations, and that's what they want to follow. With healthcare providers having that area of expertise. So these goals of care conversations do go through all of these things. And it's very important so that we can tailor your care to yourself. So we have looked at some of the challenges that patients and families have identified in the area of advanced cancer. And we've heard a lot about really lengthy wait times have been very distressing for patients. We see patient distress and provider frustration when we're waiting for referrals or test results. Earlier on in diagnosis, there's sometimes a lack of screening protocols or sort of standardized pathways or even evidence-based guidelines. And we need to, on our part, do a better job of those things sometimes to help bring in this type of approach where we're focused on each individual patient. There's sometimes variable access depending on where you are. I'm sure a lot of you will have experienced something like that where you're unable to access diagnostic tests very, very quickly. And that, also is sometimes supported by geography, like I said, where you live, or sometimes by age. Sometimes we've seen a really poor coordination of care where the providers aren't talking to each other. Maybe you've had a really great conversation with one of your providers, but somehow that doesn't get relayed to the next provider, and you're repeating the same story over and over. That can become very frustrating. And then there's often limited access to information for patients and families to kind of know, like, what are the next steps? What's going on? What's my actual diagnosis? What stage am I in? And so these are some of the patient and family identified challenges that we see in advanced cancer. We also see this communication. Sometimes, us as providers, like I said before, it can be hard to talk about those things. And it's really a skill that we can learn. So, poor communication skills of providers has been identified as a challenge. This miscommunication between providers, or not seeing the results actually communicated to other providers very well. And sometimes there's a lack of provider engagement, of commitment to patient self-care. And of course, as everybody has seen as well, we do have human resource challenges. Sometimes there are unmanageable workloads and shortages of primary care physicians, especially in our more rural areas, and a lack of specialists to really help those with advanced cancer. Some of the other outcomes that we've seen, it's really important to pay attention to those symptoms. We need to be more aggressive with the preventative screening and checking out of symptoms. Sometimes patients will feel that they were really dismissed when they present with symptoms, and that can be very, very frustrating, and of course delay a diagnosis. We need to sometimes increase the efficiency of our system. So when we're working sort of in silos and not communicating very well, really, if we did a better job of communicating those, we could actually not overlap some of the same tests and make things move along more quickly within the diagnosis and treatment of cancer. And we need reliable information. Patients need to be provided certainly with more information about diagnosis, about prognosis, about potential treatment options, and then information that really outlines the impact of those things. Then we also look to about systemic data. It is important for us, that should be available within each of the cancer centers, so that we're creating a better quality of community of practice. And then management of our process. So avoiding those overlapping procedures or repeat procedures, and the necessity of patients, like I said, repeating their history to each new provider. If we have better communication, like through an electronic health record that's available to your different providers, is helpful. And then also our system navigation. So knowing, where to go and how to access these things, and providing that coordination throughout that is helpful for patients. So looking at some of the solutions that have also been identified by patients and families, a lot of the challenges that contribute to an increased need for this psychosocial support are caused by larger problems in the healthcare system that are beyond the expected distress associated with a cancer diagnosis. Some of these solutions, include screening and wait time. So educating the public and primary care physicians is really important, so that we know, so that they have a better awareness of diagnosis and what symptoms could be indicating. So that primary care screening, and developing screening guidelines and incentives for those primary care providers. Patients and families also suggested developing an integrated provincial screening program for diagnostic assessment to streamline the management of a cancer diagnosis. As far as access goes, centralizing referral systems and tracking those referrals, actually develop the role of a patient navigator. So some of you may have also had access to a patient navigator, which can absolutely help to coordinate that care and move it along. And other suggestions for communication was to provide communication training to providers to make them more comfortable in having those conversations, and helping improve the knowledge exchange amongst them and information links across the system, and to provide and validate information resources for patients. When you have that information, you can feel more in control of your care. And of course, we do need to increase our human health resources. And I would say that especially goes for our northern communities. We've seen a lack of access in those cases, as well as, of course, other geographic locations that are difficult to get to. And so for us to look at increasing our human health resources. Some other solutions was an online resource that would offer information on what you might experience in treatment, or even self-monitoring tools, providing a tracking journal or access to the hospital system for reviewing information about a specific patient, and to check appointment schedules in real time. It can be very difficult across numerous different medical records to actually make a good coordination of those appointments. And as well, a pre-oncology orientation session to the resources that are available. So I hope that anybody who has needed any of the services that I mentioned today actually knew about them and had access to them. So if we create a pre-oncology, before you start your treatment, orientation to resources that are available, with reminders sort of throughout your time at the cancer center that these things are available. And another suggestion was an online care map for patients to know what to expect while waiting. What is the next step? What are we waiting for? So, living with advanced cancer can bring many changes and challenges, but patients and caregivers are not alone. Understanding the language used in cancer care and having clear conversations about goals of care and knowing what supports are available can help you make informed decisions and feel more prepared. And certainly, I just want to reiterate that advanced cancer does not mean the end of care, but rather it opens the door to treatments and supports that are focused on comfort, on quality of life, and what matters most to you. So early open communication with your healthcare team ensures that that care aligns with your values, while palliative and supportive services provide practical, emotional, and spiritual help for both patients and caregivers. By staying informed, asking questions, and connecting with those available resources, patients and families can navigate this part of the trajectory with clarity and with confidence and with compassionate support. So I just thank everybody for joining today. And if we do have any questions, I would love to hear them. Oh, thank you. I'm so sorry. I totally forgot to define this. So the question is, what does polypharmacy mean? I'll start with that one. So polypharmacy just means multiple pharmacy medications. So it's the overlap of many different medications. And sometimes we have too many on board, and the effects of one can create a problem. Like, for example, if somebody's having pain and we prescribe a strong pain medication or an opioid, then sometimes out of that we create constipation, right? And so then, okay, now we need to prescribe something for constipation. And then sometimes the medications that we prescribe for constipation creates more problems. And so we have this whole additive effect of the side effects of medication and just adding on more. So that would be polypharmacy. And the second half of that question is, where is there room for functional medicine options as well? And that is a great question. We actually do at Cancer Care have a pain and symptom clinic, and that actually includes a physiatrist. And I think that's something that most people aren't aware of, that we do have a physiatrist as well who can help with those functional medicine options. And so absolutely that is a referral that can be made either to the pain and symptom clinic or the physiatrist as well. A good question. The next question is, what kind of support is provided to practitioners, residents, medical students on how to have these really difficult conversations about advanced cancer? Yeah, that's a great question. And unfortunately, we haven't seen a lot of that being done. But there are some tools that we can use as providers to kind of guide those conversations. There's, there's a one called the Serious Illness Conversation Tool. And I would actually encourage providers to bring that into the visit with them if they're not comfortable. It's a nice step-by-step way to have a conversation and sort of what questions to ask and what information to tease out. There's not a whole lot of in medical school or even in nursing school specifically on that, but there are a lot of supports out there for providers who do want to learn more, and they can be accessed. As far as cancer care goes, we've actually done a number of education sessions and presentations on how to have those conversations, and we're actually shortly going to be offering what's called essentially a simulated patient. So that's an actor who comes in, and it gives the care team a chance to practice those conversations without feeling like, oh no, what if I mess this up? I don't want to say the wrong thing, or I don't want to hurt my patient's feelings, and just gaining that confidence in having those conversations. And so we are bringing in some more education in the next few months, and I really look forward to how that will better support staff to have these conversations. The second half of that question is, and how is the care team supported to begin these conversations to ensure everyone is on the same page when it comes to understanding next steps? So that's also a great conversation, a great question. And that does come with those conversation tools as well. We have a number of different tools. There's a different tool that's really for like how to give essentially bad news, and to help providers to have a step-by-step formula. Obviously, it doesn't just work, okay, this and then this and then this, but it really helps to guide that conversation. And that should be for sure part of conversations, right at the beginning when you meet your healthcare provider to talk about treatment options. Excuse me, but that should also be an ongoing conversation. Like if a treatment isn't working, we need to have that conversation to make sure that, like you said, everybody's on the same page. So yes, that is something that would be helpful actually to build into our systems and have a flag about when these conversations should be had, and something that we are looking at right now. So thank you for that question. Do we have any other questions? Sure, yeah. Yes, absolutely. Different implications for different types of cancers. So when we're looking more so in our solid tumor cancers versus a blood cancer, those can have completely different meanings. Um, Obviously, the blood is everywhere in our body, and so that might technically be spread beyond some sort of initial starting point. And so that would have a totally different implication as to the curability, not necessarily treatability or manageability, but curability of a cancer. So your oncology team is the best place to have a conversation about that. And really asking questions of your care team, whether it's the nurse who came to see you, whether it's the physician, it's really okay to bring that up with either of them. Even if you have one of our psychosocial oncology clinicians, having that conversation in that space can then be relayed to the physician or the nurse in the clinic. We do document these conversations as well. And so to bring that up and like I said, asking questions, okay, what is this treatment going to do for me? How is this treatment going to impact my day-to-day life? Or how is it going to impact my ability to XYZ, the thing that's important to you? Asking those questions yourself. If the provider isn't bringing up the conversation themselves, that's one way that you can start that conversation is to, how is this going to impact me? What does this mean for me? Will I be able to do XYZ that's important to me? And kind of get that ball rolling that way.